Hi, my name is Dr. John Preston. I'm a professor of psychology at Alliant International University in Sacramento, California, and it's my pleasure to present this short video that takes a look at stress and anxiety, how to manage this. And I'm going to start with this quote from Jane Wagner, which I think is cute. Reality is the leading cause of stress among those who are in touch with it. Ain't that the truth? What we're going to do is the video is going to be divided into three parts. The first one is understanding stress and anxiety symptoms. Okay. Secondly, are some general approaches to reducing stress symptoms. And then finally, we're going to take a look at rapid stress reduction techniques and professional treatment for stress and anxiety disorders. So let's get started with part one. Lots of people talk about, I'm under a lot of stress, but that's kind of a general comment. The many phases of stress, there clearly are sometimes where people experience enormous amounts of anxiety and stress-related symptoms, but it's situational. That is, it's limited to a particular situation or a particular period of time that once that's over, then it goes away. We're not talking about enduring problems with anxiety and that sort of thing, but it is clearly tied to particular circumstance. Secondly, there are people, and we all know these people, who are living continuously in situations that are very psychologically demanding and challenging. And so they may have prolonged symptoms of anxiety in large part because their circumstances don't change and they're having to deal with financial difficulties, discrimination, poverty, and so on and so forth. Third on the list are anxiety disorders. The anxiety disorders we're only going to talk about briefly in this video, but these are disorders that are very, very common. And they may or may not be related to stressful life events or circumstances. Now, there are some anxiety disorders that emerge in the wake of major life stresses. However, there are a number of these that seem to come out of the blue, and this would include disorders like panic disorder. We'll talk about that a little bit. Obsessive compulsive disorder, generalized anxiety disorder, and many of these are felt to be in part related to genetic factors and genetic vulnerability and biologically based. Anxiety disorders, unfortunately, are, with a few exceptions, tend to be very persistent. For instance, people that have panic disorder, if it goes untreated, it can last for decades. The same thing is true for obsessive compulsive disorder. And they are a disorder mainly by definition because they are so severe they really interfere with the person's functioning in life, not only causing a lot of suffering, but interfering with the ability to do a good job at work, school, or in social relationships. Here we have the yearly and lifetime prevalence rate of anxiety disorders. I'm not talking about stress in general, but I'm talking about these more severe psychiatric disorders. And you can see that over the lifespan, about 1 out of 4 people will experience these anxiety disorders. So they tend to be the most common of all the psychiatric and psychological problems, at least in the United States. This is a list of anxiety disorders. I'm not going to go over this, but this list with some explanations about the particular disorders can be found on this website. You can access that, look at it on the computer screen, or download to get more information about the particular anxiety disorders. We're going to focus a lot more on sort of general stress. So understanding stress, some definitions. Someone says, oh, I have a lot of stress. What does that really mean? Well, let's get technical about this, okay? The term stressor, first on the list, these are the things that activate a stress reaction, okay? So they can be events, like for instance, getting fired from a job, or having a breakup of a marriage relationship, or something like this. So concrete, identifiable events. But also, oftentimes there are thoughts that can provoke stress, and this is very, very common. And we're going to talk a fair amount about this. But an example might be, I don't know, if I'm going to get fired or not. But they're laying off a lot of people, and it could happen. So that's not an actual concrete event, but in my own mind, the anticipation of something like that can generate a significant amount of stress. Then we have the stress response, and these are the particular symptoms. We'll look at that here in a few minutes. Worry. Let me take a minute to talk about this. Some people say, oh, I'm really worried about something. Worry really is, as it says here on the slide, non-productive recurring thoughts. Now, there are people who are going through a really hard time in their life, and they're doing a lot of thinking, but sometimes it's not worry. Sometimes they're thinking, okay, now wait a minute, I got to get clear about what's going on here. So it's about trying to understand what's happened, and then problem solving, and that is kind of evaluating, okay, I could do this, this, or this, what would work out best. That's not worry, because that's kind of thinking that leads to understanding and then also taking action. But worry is the same old stuff over and over and over again. It doesn't correct the situation, it doesn't come up with solutions, but it does generate a lot of anxiety. Let's make a distinction between fear and anxiety. There are some similarities. Some of the physical symptoms are similar, but with fear, what this is really about is, as the slide says, imminent and certain. So this is happening right now. I'm afraid of something, for instance, unambiguous. This guy is afraid, okay? This man does not have an anxiety disorder. This is real-time danger, and it ignites a fight or flight response. Now, in contrast, anxiety, most of the time, it has to do with anticipating things that may happen. They're not happening right now. So there's some degree of uncertainty or ambiguity about this, and it's not going to happen in the next few minutes. Again, a lot of symptoms are similar, but there are some differences here. I like to use this slide, the classic fight or flight response we all learned in Psychology 101 in college, and this CEO here is being chased by a saber-toothed tiger. The biologic response, oftentimes referred to as fight or flight response, is pretty much hardwired into every organism, or at least every animal. And it's when danger is perceived in the environment, immediately activates changes in hormones and bodily functions, brain neurotransmitters and so forth, that mobilize the body to take quick action to get away from danger. And clearly, real danger situations provoke fight or flight responses. But fight or flight responses, at least in nature, in all animals, including human beings, in nature, was really designed to handle very short-term stress that is also very potentially life-threatening. So in early human beings living in equatorial Africa 1 million years ago, or the gazelle grazing on some grass, watching out for lions. When we have a fight or flight response, typically there's rapid mobilization when danger is perceived, and you get all these massive changes in body function, but they usually last 3, 4, 5 minutes. Because in these natural settings, in a very short period of time, either you got away or you got killed. And so the biology of this is well adapted to activating people so we can survive in dangerous situations. But it's not well equipped for long-term stress, which a lot of us human beings experience. Many times there are stressors that just don't seem to go away. Okay, you'll pardon me, I'm not trying to be offensive towards mothers-in-law, but this is based on a long-term study I've done of my own mother-in-law. Or how about the Internal Revenue System? Anyway, let's take a look at symptoms. Now, on the website, you will have a list of symptoms. I'm going to run through this very quickly right now, and then if you want to download or look at the symptom list on the website, you'll have a chance to study it in more details. But typically, when people are experiencing fear or anxiety, they break it into 3 different groups of symptoms. First are thoughts. And here we have worry, the same old stuff over and over again. Obsessions, like I can't stop thinking about something. I have inaccurate conclusions like, oh no, I know my wife's going to leave me, when in fact, maybe she isn't. People are constantly trying to predict what may happen, and there's a role for that. It helps people get ready to take action if they need to. But a lot of anxiety is generated by people making conclusions and predictions that really are not likely to happen. They could happen, but they're not likely to happen. And yet, in the moment, saying, gosh, what if I get fired? What if my lab test comes back and I've got some terrible disease and that kind of stuff? That tends to generate a lot of anxiety. Behavioral, we have avoidance. We'll look at some examples of this a little bit later, and then we have physical symptoms as well. And here's where a lot of people that are experiencing the physical symptoms of anxiety understandably become worried that maybe they're having some kind of a medical problem, especially one thing that people worry about is, am I having a heart attack? And so if people have things like rapid heart rate, for instance, tightness in their chest, and so on and so forth, they may think they're having a heart attack. And if you think you're having a heart attack, whether it's anxiety or not, you should always go to the emergency room. So here are some of the symptoms, and here's some other ones: lightheadedness, frequent urination, insomnia, and so forth. So there's significant biologic responses to fear and anxiety. Fear is much easier to determine where the cause is because people are pretty clear about the factors that they're reacting to. However, some anxieties are very situation specific, and these would be examples of phobias. An example would be maybe someone who has a fear of flying in an airplane, or someone who has a fear of public speaking. They're not feeling really anxious anytime, except more than normal, except when they have to be in that situation where they feel an enormous amount of anxiety. People can suffer from generalized anxiety disorder, and here the person's pretty much anxious all the time, even though there are not huge psychological stressors. It's the stressors of just normal living generate a lot of anxiety, and people with generalized anxiety tend to worry a lot. That's really at the heart of generalized anxiety. What if this happens? What if that happens? Next, we have panic attacks. And what I want to do in talking about panic attacks is I want to show you a video of a panic attack. This is a dramatization, but it is very accurate about the experience of somebody having a panic attack, and then explain how this is really quite different than most other forms of anxiety. Okay, so here I'm going to go ahead and switch to the video.
16, is that the Hawkins agency? Yeah. Well, that's a good company. I have a friend who works there. Have you been up to their offices before? Oh, no, of course not. Today's your first time. Listen, why don't you bring them down to our place and show them what a great job you did? Anyway, I'm sure you're going to do a terrific job. Do you remember Steve, my boss? Of course you do. Well, he talks about you all the time. It's amazing that you just... Linda, are you okay? Oh, I'm sorry. What? You don't look too well. I don't know. Something's wrong. I have to get off this elevator. I have to get off. I have to get off right now. Okay. God. Oh my God. We're dying. Linda? Linda, just sit here, okay? I'm gonna go get some help.
Okay, this is actually a very realistic dramatization of a panic attack, and here's what a panic attack looks like, okay? It's different than generalized anxiety or continuous anxiety or worry. It has a very sudden onset, and it rapidly escalates into extremely severe anxiety. By definition, a panic attack reaches its peak in 10 minutes or less, but the truth is a lot of panic attacks are like the one we saw on the video right here, where they last maybe 2 or 3 minutes. But almost never do they last more than 10 minutes, and then they begin to subside. Now, people in the aftermath of this may feel real shaken, of course, by the experience, but the actual attack itself is measured in a real short amount of time, okay? Panic attacks can be cued, meaning they can be, in people who have panic disorder, they can be activated by stressful situations. It's possible that getting into the elevator, in this case, was a cue that activated the panic attack. But many people who have panic disorder have uncued, and what that means in plain English is a panic attack just comes out of the blue, like you're sitting at home in your family room reading Better Homes and Gardens or something, and out of the blue you get hit with a panic attack. And obviously that really scares people, especially because it's hard to make sense out of that. Some people have panic attacks that are called limited symptom attacks. And it's the same thing. It has sudden onset, gets full intensity in 10 minutes or less, and then subsides. But here, it's not at the level of full-blown panic attacks. And so I want to mention a couple things about this, okay? Because we're not going to focus a lot on panic disorder, but I want to be very clear. When a person first has a panic attack, often some of the symptoms are racing heart, chest pain, shortness of breath, and this can be identified or misidentified as a heart attack. You should never assume that it's a panic attack if you have those symptoms. You need to go to the emergency room. Many of these symptoms, actually, when you come into the ER, initially it's hard for the doctors and nurses to make a clear diagnosis about is this panic or is this a heart attack until they get an EKG, get some blood work and that sort of thing. So there's no reason in the world to take chances about this. Now when people have had several panic attacks, they've been medically evaluated and find no sign of cardiac disease, then we're talking about a different story. But initially when this happens, it's always best to be on the safe side. Panic attacks can occur occasionally with really severe stress, but typically they're associated with panic disorder, which by definition people are having multiple panic attacks each week that seem to come out of the blue. And there are many people that their life circumstances have not been unusually stressful, but they just start maybe at the age of 27 or 32 or something, start having panic attacks. And these are more likely to be biologically based problems, and they do respond to treatment that we'll be talking about later on. Panic attacks are rare in children. We're looking at pre-pubertal children. And typically if you have a classic panic attack in children, that's kind of a big red flag that they may be experiencing some significant kind of psychological trauma. Not necessarily, but it's a warning sign that something may be going on in their environment that really needs to be evaluated very carefully. Things like either direct forms of child abuse, or they're witnessing domestic violence, or something along those lines. The importance of a diagnostic evaluation, just looking at the symptoms alone is not enough. And this is where visiting a primary care doctor, most diagnoses of anxiety disorders occur in a primary care setting. The average time of a primary care appointment, it varies somewhat. It's between 7 and 17 minutes. And that's really not enough time to adequately evaluate the history and the nature of the symptoms. It's going to be really important to talk to a doctor for a greater length of time, or a psychiatrist, or a mental health professional who are going to do a comprehensive evaluation. And this is not just looking at symptoms, it's looking at how did this start? What was the onset? What's the duration? How common is this occurring? Like if you have waves of anxiety or panic attacks, how many times per week? You want to see if it's associated with particular life circumstances and so forth to get a more clear picture about this. Many times people say, I don't have a clue about why I'm having all of this anxiety. But for the last 6 months, I'm nervous all the time. I'm tense. I have trouble going to sleep. It's possible when people cannot identify a cause for anxiety symptoms that it may be something that's biologically based. In a little bit, we're going to talk about some medical disorders that cause anxiety. There's some drugs, prescription and over-the-counter and recreational drugs that cause anxiety. But also, there are times when people are very anxious due to life circumstances, but they haven't really gotten clear about why they're nervous. And a good example of this, and I've seen this a lot, someone comes in with significant anxiety symptoms, and they're being absolutely honest and straightforward and say, I don't really know why this is happening. And so they're with a therapist for maybe a session or maybe two to carefully take a look at their life. And it may become more and more clear over a period of time during that first 1 or 2 sessions that actually, in fact, there are things that have maybe increasingly become much more difficult, like decreased intimacy in a relationship, or the separation stress that parents feel when adolescents start to pull away from them, and so on and so forth. So if somebody says, I don't know why, that does not necessarily mean it's biologically based, because it could be psychological, but they just haven't quite figured it out yet. But it's also worth looking into the possibility that there may be a medical condition or a drug that is causing this. Is it a medical condition? We're going to take a look here briefly at medical disorders and drugs that can cause anxiety. And here we have slides. Nobody watching this video is going to be able to read all these slides and get useful information. So this is being posted on this very website. You can go to that and take a look at these various disorders that can and often do cause anxiety. But I want to talk to you about one of my own cases, and this is a case where I really blew it, where I didn't know what I was doing. I was in graduate school, and I was in my last year of graduate school, in my doctoral program, and for the first time I met the man who was going to be my father-in-law, and thinking I was this hotshot psychology student, I recognized right off the bat this man has generalized anxiety disorder, because this guy was just nervous all the time. He had ants in his pants. He couldn't sit still. He was just nervous, and pacing around a bit, doing this, for a long time. And I thought, well, this is obvious. This is generalized anxiety disorder. They taught that, in our psychopathology class. Yeah, well, guess what happened? A month later, they find out that he has a disorder called pheochromocytoma, which is a tumor on the adrenal gland, and it's relatively rare, but it can cause enormous anxiety and high blood pressure. And so he had that removed, and then he was just calm as could be. So this is just a good example of how, first off, I didn't know what I was doing, but also needing to not jump to conclusions about things until you thoroughly investigate that. Now, there also are a lot of drugs that can cause anxiety as well, and here's a list of them. And here I'm going to talk to you about another case that I did where I actually figured out what was going on. There's a guy who was in his early 60s, and he never had any history of severe anxiety. And about 6 months before I saw him, pardon me, he started having just a lot of anxiety all the time. And he was nervous, and he's in trouble going to sleep at night. And so his wife took him to his primary care doctor, and they ran some blood tests, and they didn't find anything. Eventually, he was referred to the psychiatry department. By the time I saw him, 6 months into this, he'd been tried on antidepressants and tranquilizers, and actually several other kinds of medication to treat the anxiety, and none of the drugs were working very well at all. And so he was referred to me just to get a second opinion or do psychotherapy with him. And the third time this gentleman did this, it's like a light bulb went off. He was sitting in my office, and he could hardly sit still. This poor guy was so nervous. But he reached in his pocket and pulled out a bottle of nasal spray and snorted nasal spray. And within 20 minutes, he did this 3 times. And the third time he did it, I said, "Excuse me, sir, but do you use a lot of nasal spray?" And he says, "Well, yeah, actually I do. I use a bottle per day." And you can see here we have nasal decongestants. And there are some people, now he wasn't abusing this. He wasn't getting a buzz or a high off of this, but he'd had some kind of, whether it was a sinus infection or allergy, I don't recall, but he started overusing this nasal decongestant, and at some point your body develops tolerance for that, and so he was having to use it frequently to keep his airway open. This is also true for oral decongestants like Sudafed, for instance. So again, we've got to keep in mind that we may have medical conditions or drugs that are causing the problem. Now, one of my professors in graduate school, who was from the deep south, said, "Y'all remember dogs can have fleas and ticks." And that's worth keeping in mind. And what he meant by that is sometimes someone presents with particular problems or symptoms, but it's not just due to one factor. There may be other things going on. I learned my lesson early when a man came to see me. It's my first year out of graduate school. He came to see me, and he had enormous anxiety, accompanying some depression and a lot of grief after his wife was suddenly killed in an automobile accident. And again, this man was just wringing his hands and could hardly sit still. And it was later determined, after I started doing psychotherapy and we started with antidepressants, that he has hyperthyroid. He has thyroid disease. And that's why he wasn't getting better. And I made a big mistake assuming that there was, it's a no-brainer. His wife is killed in a car wreck, And after that, he starts getting really anxious. That's what's going on here. Well, of course, that's a lot of what's going on here, but he had the misfortune of having the thyroid condition really start to get ignited around the same time that this life event occurred. So we have to cover all of the bases and always make sure that there isn't some kind of underlying medical problem that is either the cause or is contributing to the symptoms and interfering with treatment being successful. Okay, so welcome to part 2. General considerations for the treatment of anxiety. This is a topic we've talked about for a really long time, but I'm going to try to condense this. And let me state the obvious, and that is, if it's determined that there's a medical condition or it's being caused by some kind of drug, then the obvious thing is to treat the disorder or to try to address the drug or drug abuse. Beyond that, there are a number of techniques in general for people that are experiencing significant stress that can have an impact, a positive impact on the brain, which results in better stress tolerance and decreased stress symptoms. So let's take a look at this. We're going to look at 4 things under this category. First off, eliminating substances that cause anxiety, improving sleep, the role of exercise, and also a little bit on psychiatric medications. This is one of my very favorite slides. One of probably the most common drugs that's used that causes, at times, enormous anxiety is caffeine. Of course, it's not just limited to coffee. There are many things that we ingest that contain caffeine. But let me just show you an example of this. In this particular study, at noontime, they gave to healthy adult volunteers 500 milligrams of caffeine. It was given to them in pill form, and they either got the real caffeine or a placebo. And then by 6 o'clock, they went in and they got a blood sample from these 2 groups. And by 6 o'clock, the group who had ingested 500 milligrams of caffeine at noon had 32% higher levels of adrenaline in their bloodstream than the group that had ingested placebo. Now, for point of reference, 500 milligrams is equivalent to 2 mugs of coffee. And I would encourage you, or any family members that are experiencing a lot of stress, to evaluate the amount of caffeine that you or they are consuming. And available on this website is a free download. It's a caffeine questionnaire. It's a very straightforward way to determine the amount of caffeine that a person is using on a daily basis. Reducing caffeine, therefore, oftentimes itself can significantly reduce anxiety. Number 2, improving sleep. Sleep really is the guardian of the brain. According to Shakespeare, it's the bath and balm of hurt minds. Any emotional problem, whether it's depression, bipolar disorder, and panic disorder, or generalized stress, is going to be more significant and harder to deal with if a person is getting poor sleep. Let me talk very briefly about the kinds of insomnias that occur. These are things, interference of sleep, that people are really well aware of, okay? The first is seen mostly with anxiety and generalized stress, and that is difficulty falling asleep. Typically, if stress or generalized anxiety is a culprit, then when people are able to go to sleep, typically they stay asleep, but the trouble is falling asleep. With depression, a person may or may not have trouble going to sleep, but the biggest problem with depression is staying asleep, waking up a lot during the night, tossing and turning, and then early morning awakening. And the last thing is sleep inefficiency. Now, sleep inefficiency has to do with the quality of sleep, and this can only really be measured precisely by looking at brainwave activity in a sleep laboratory. Now, most people do not need to go to sleep laboratory, but I just wanted to mention that's where they get the information to determine if a person is having problems with restorative sleep. In a nutshell, as probably everybody has been exposed to sometime in your education, people go through different phases of sleep at night. On top we have the dark bars represent rapid eye movement sleep where dreaming occurs. But I want to focus primarily on stages 3 and 4, and these are the phases of sleep that contain deep restorative sleep. And I want to call to your attention that the first episode of deep sleep, now this is for middle-aged adults, it's going to be different for elders. The first episode of deep sleep occurs probably 20-25 minutes after falling asleep, and it also tends to be the largest slice of deep sleep that you get the whole night through. And this is going to be relevant here in a few minutes when we talk about some other issues. What happens if you don't get deep sleep? There are people that sleep 8 hours a night, but if they're not getting enough deep sleep, restorative sleep, everybody is going to feel tired. That's probably obvious. Increased anxiety, their ability to control anxiety symptoms, and also trouble staying focused and concentrating are going to be impaired. Disturbed sleep. Different reasons that people are not getting adequate sleep. One of these is they choose to sleep less. And this is just staying up too late. That's all it really means. Sometimes people enjoy doing this. They stay up late to watch movies or be on the internet. Often, however, when people are experiencing a lot of anxiety or stress, they may be staying up late as a distraction from worrying about things. And so they are not getting enough sleep, but they, in a sense, stay awake long enough that then they can fall asleep because they're so tired, but the result is they're not getting enough sleep. Chronic pain can, for many reasons, significantly interfere getting quality sleep. Substances. These are the primary ones: alcohol, tranquilizers, and some sleeping pills. What do they have in common? One is about 15% of people that take or that use alcohol and prescription tranquilizers and sleeping pills will abuse them. They can become addicted to these. They get a rewarding feeling, a high off of this. Most people don't. The majority of people don't abuse these drugs. However, many people who are under a lot of stress use and overuse some of these drugs as a way of self-medicating, primarily to help them calm down from anxiety and especially to go to sleep. So there are many people that will say, well, 3 glasses of wine before bedtime and it really helps me go to sleep. Otherwise, I'll lie there for an hour tossing and turning. The same thing can be said for tranquilizers and most prescription sleeping pills. Here's the point. These drugs they sort of mask a problem. The person thinks it helps me because I go to sleep better, but what they don't realize is all 3 of these substances, especially alcohol, but all 3 of them reduce the amount of time spent in deep sleep. Let's talk about caffeine. Excuse me. It may be hard to really figure out how could a person who's under a lot of stress or having enormous anxiety problems increase their caffeine use when they're stressed out, since caffeine increases adrenaline and stress symptoms and interferes with sleep. And it's a fair question, and probably the reason for that is because people who are going through enormous stress are not sleeping well and they are exhausted. And they're drinking coffee or tea or cola or something like that, like a lot of us, to stay awake so that they can work, so they can not fall asleep in school, so they can drive safely and that kind of thing. Without realizing that actually the caffeine is one of the most potent drugs actually that can increase anxiety symptoms and interfere with sleep. So you can go to, I think I mentioned this before, the website has a caffeine questionnaire where you can determine the total amount of caffeine being consumed. Included here are, in the last 5 years, energy drinks that have a lot more stimulating herbs and dietary supplements in addition to caffeine in there, so that can be a big problem as well. So caffeine directly causes anxiety symptoms. All right, it interferes with the ability to go to sleep, and it may reduce the amount of time spent in deep sleep, and that's an important point. So really, when people are experiencing enormous stress, then it's important, if at all possible, to gradually get down to no caffeine at all. If a person's drinking 4 cups of coffee a day, if you stop cold turkey, there's going to be caffeine withdrawal symptoms, which can be very unpleasant, headaches and jitteriness and that sort of thing. So it may take a month to gradually wean yourself off. For some people, having a cup of tea or coffee in the morning may be okay, but it's extremely important not to have any caffeine after noon, because that's where it can still be in your bloodstream by the time you go to bed and interfere with the ability to go to sleep and to get into stages of deep sleep. We also have sleep disorders that oftentimes go unrecognized. These are common, they can last for years, and they are notorious for interfering with deep sleep. And yet, even though they go untreated sometimes for years, they're very treatable. And these are the 2 primary sleep disorders that are most common are obstructive sleep apnea. Let me just explain what this is. This occurs in up to a fourth of men and 10% of women. So it's real common. And here the person goes to sleep and their airway begins to collapse and they cannot get air past the collapsed airway. So it causes them with great exertion to inhale and suck air past the collapsed airway. It makes a lot of noise and then they feel okay for 15 seconds. But then the oxygen supply in the bloodstream starts to drop because they can't get through the collapsed airway. In other words, they're going to have multiple episodes of what is called apnea, and that's this gasping kind of sound. And this may involve 200, 300, or 400 times per night. Now, most people who sleep with somebody like this are going to notice this and say, hey, buddy, there's something wrong with you. You could be a partner, a wife, or a husband. But what's really common and maybe kind of surprising is a lot of bed partners, they hear this, but within days, they just habituate to it. They just start tuning it out. And so there are people that are sleeping with somebody that have sleep apnea has been going on for years, and their bed partner doesn't know. So in evaluating this, we want to ask if they do have a bed partner, what their observations are, if they have any of these particular symptoms of gasping for air numerous times during the night, and then a severe restless legs syndrome can really interfere with deep sleep. Both of these cause a decreased ability to control emotions, in particular anxiety. And I should say, as an aside, a lot of restless legs can be resolved by eliminating caffeine. There are some other causes for restless leg syndrome, but caffeine can either cause or intensify that particular symptom. How do you improve sleep? Okay, this needs to be brief, but here are a few things worth taking a look at. Worry is a frequent cause of insomnia. This cartoon says, I can't sleep, I think I'll get up and solve all my problems. And the problem is, and all of us from time to time experience this, is these thoughts going through a person's mind again and again and again. Worry, like I described before, not problem solving, okay, not adaptive, but they generate anxiety and keep people awake. So there are two approaches that are quite effective in many people who have trouble falling asleep because they can't shut off a busy brain. Let me do the one on the bottom first, and that is to sit down and, maybe an hour or half an hour before going to bed, get a pencil and paper and write out a to-do list for tomorrow. Lay it down, and many people then can go to bed and go to sleep. It's surprising and remarkable. This may work for about 50% of people. It seems so simplistic that it wouldn't work, but this is one of those things that's great that you can do an experiment, do it one time or two times, and find out if it works. And I've had some patients say, you know what, that really works for me. Okay, so that's one strategy. The other strategy has been developed by a really quite well-known researcher, James Pennebaker, psychologist, and his approach is not an hour before bed, but right before retiring to bed, is if you notice yourself, just all these worries going through your mind, is get out a piece of paper and pencil and write down verbatim, what's going through your mind. Okay, so for instance, it may be that the person writes down, there's increasing pressure at my work to do more. I'm having to work through lunch hours. I'm really afraid that if I don't do this and start taking home work on the weekends, that I'm going to be in that group of people that are going to get laid off, and that could be a disaster. Now, if you just write down work problems and financial problems like an outline, that isn't going to do it. But what this guy is doing is he is writing verbatim the thoughts that are going through his mind, and remarkably, more than half of people that do this will find that their brain just shuts off in terms of the worry. I don't know why exactly this is the case, but it's likely that there's something about this inarticulated, vague worries. Once you put them down on paper, they're more conscious, they're more concrete, and in a sense it's kind of like getting it out of your system. So again, this is a very good experiment to do to see if this actually does work. The one group of people who should not do this technique, however, are those that have experienced really severe psychological trauma. Because if you begin writing about traumatic experiences, it may open up the floodgates and cause enormous anxiety. So that certainly is one group where this is not recommended. Another approach to helping yourself fall asleep is to get bored. And really there's two sides of the coin. One is, oh, that one. Okay, let me start over again. All right, take two. Another approach to falling asleep is to get bored. there are really two sides of the coin. One of those is to avoid things that are too exciting, too stimulating. These are things like exciting television shows, Monday Night Football, and things like that. I mean, these things are important as a part of our life, but when people are going through really stressful times, what may be more important is to get good sleep and really get a handle on stress and anxiety and plan some of those activities for earlier in the day or on the weekend. Then there's getting bored, per se. And the old adage was count sheep. And I remember hearing this ever since I was a kid. There was a study done about 10 years ago in England where they tested this out. They had people that had long-term insomnia, excuse me, and they divided them into 4 groups. One was a sleeping pill, prescription sleeping pill. One was a placebo. One was to teach them relaxation exercises, and the final thing was to count sheep. And as you might imagine, the technique that did not work at all was counting sheep. So in principle, if you could count sheep, it'd probably be boring enough to help you go to sleep. But the problem is when people are really undergoing a lot of stress and their life is enormously difficult, it's just hard to close your eyes and imagine and sustain an image of a sheep or anything else boring for that matter. So doing something where you get the focus of attention onto something that is not going to stir up strong feelings, excitement, or anything like that. For me, I don't mean to offend anybody, but for me, watching the Golf Channel will put me like into a coma. The other thing is I'm kind of poetically impaired, and so when I read poems, with rare exceptions, I just kind of go, what? And then I crash and sleep. So each person's going to need to figure out what it is, that puts them to sleep and doesn't stir up a lot of activity. Also, in terms of avoiding stimulation, I should mention that this involves exercise as well. Exercise, of course, as we've been talking about, it is enormously important for people in general, but for people who are undergoing a lot of stress. But if you exercise in the evening time, especially if it's more intense exercise, aerobic level exercise, it may backfire in some respects in that that can generate some stress hormones in itself and interfere with sleep. So it's better to do it earlier in the day, in the morning or maybe late afternoon. Muscle tension can also really get in the way of falling asleep and staying asleep. And I like to demonstrate this by this example. If I make a fist, then all of the sensory information, the sensory nerves that are coming from muscles and joints and tendons and so forth here are going down my arm and into the spinal cord and then up into sensory areas in the brain where they're registered. Now the problem is, as sensory information is coming up the spinal cord through the brainstem, it activates a brainstem nucleus, technically referred to as the locus coeruleus. But it's a little bundle of a bunch of nerve cells. And when it activates that, it spritzes the brain with a significant amount of stress hormone norepinephrine. And so in a sense we could say when people are anxious, they tend to often become very tense. And a lot of people carry around tension a lot of the times. They have tight shoulders and they have white knuckles and stuff like this. The anxiety is driving the tension. But then they get used to it. And what I mean by that is they habituate so they don't even notice how tense they are. People do. Their friends and coworkers say, God, the guy is so tense, but he may not even notice it. So we can say that anxiety and stress can activate muscle tension, but also the opposite is true as well, and that is tension itself is feeding in sensory information that gets in the central nervous system and actually turns up the volume on stress. So that's going to be important to address that. Two things here on this slide may be helpful. One is to soak in a hot bathtub, which can loosen muscles, although in allowing yourself to cool off before you go to bed a little bit. The other are relaxation exercises. And people have come up with any number of relaxation exercises. Some of them involve visualizing like a beautiful mountain meadow or something like that. If that works, then that's fine. However, when life is enormously difficult and people are experiencing high levels of stress, sometimes, again, it's hard to sustain that image of a beautiful scene. And so a technique that really works more directly to reduce muscle tension is something probably many people are familiar with, but it's kind of relaxation exercise where you start with one group of muscles like your hands and make a tight fist and hold it for 10 seconds and then let go. And then go to your upper arms, tense that, and let go, and go through the different muscle groups in the body. And oftentimes people are able to, once they master this, to do that actually just in a couple of minutes. That directly reduces the amount of sensory input that's being generated by muscle tension. The other thing on the screen is control pain. Of course, that's much easier said than done, and really beyond the scope of this talk, but that clearly is an issue for many people. Exercise. Two ways of looking at this. One is exercise is a quick fix. You know, if you have a gazelle in Africa and the lion's starting to come towards it, it's not going to stay frozen. Once the lion sees it, it's going to take off and it's going to run to get out of danger. And this is true in the animal kingdom, is when it's clear that you're in danger, oftentimes that's when you start running. Most people, when they experience a wave of really intense worry, anxiety, or even like a panic attack or something real severe like that, most of the time human beings freeze. They don't run. And yet what's been found is that if you engage in some intense exercise, and this would be aerobic level, for people who are fit, it could be jogging or running. For people that are less fit, it could be very brisk walking. 5 or 10 minutes, often there is a significant decrease in anxiety. And there's something about muscle action that generates and increases levels of serotonin in the brain, and that has an inhibitory effect. So this is, again, one of these things you can do as an experiment to try it one time. The next time that you or your loved one is experiencing a huge amount of anxiety, 10 minutes of exercise, and see what the impact is after 10 minutes. The other side of the coin is the longer term effects of regular exercise. And you can see here on the slide, this is what most of us are accustomed to and have heard about, and this is 20 or 30 minutes per episode of exercise, and doing this 3 or maybe 4 times a week. And this is will help people feel, after that, more relaxed. But the real benefit is after about probably 6 or 8 weeks of doing this on a regular basis. That alone is really going to significantly reduce stress levels, and a lot of the physical symptoms of anxiety and stress will really be the intensity will drop noticeably. It also helps to promote more deep sleep. So before we end this part, let me mention that for many people that are experiencing a significant amount of stress-related symptoms, eliminating or reducing caffeine and alcohol is important. Regular exercise, maintaining perspective, and the last thing is to take direct action on stressors. That's gonna really solve the problem. People may not need professional help. Let me give you a metaphor, okay, for this last one. If there's a fire in the middle of your living room, you could go and open up the window and turn a fan on and try to get the smoke out. And that's one way to make the air more breathable. But the other is to go right to the fire and put it out. And this last one is about taking action to change a situation, to negotiate for changes in a relationship, possibly to change a job, or take direct action to correct a problematic situation, not just dealing with the symptoms. Okay, so welcome back, and we're into part 3 now. And the first thing in part 3 we're going to talk about are medications for anxiety and stress. And I tell my students when I'm teaching about psychiatric medications, when you hear about a new drug that comes on the market, and these days we see ads on TV for these new medications, the new wonder drug is going to fix everything, it's going to be great. I advise them to look at it from this perspective, and that is to say, wonder drug, I wonder if it's going to work, and I wonder if it's going to kill people. Because once drugs are released, obviously they've been approved by the Food and Drug Administration for having effectiveness and safety, but many drugs, as all of you know, after they've been out for a year or maybe longer, and thousands of people have taken the medication, then what becomes apparent is, are these drugs really as good as they thought they were? when originally released, and are they safe, and what are the side effects? So with that little warning, let's start talking about medications here. Now, using drugs for situational stress, if there is a really severe traumatic stressor, and this could be involved in a horrible car accident where you see people killed or loved ones who terribly injured or killed, a house fire, sexual assault, or something like this. Commonly, people are given tranquilizers to use for a day or two. And the tranquilizers, we'll take a look at them in a few minutes, but they're common drugs like Xanax and Ativan and Klonopin and so forth. And there's really nothing wrong with that at all. In fact, it's an effective way to reduce the intensity of stress following these horrible life events. Now, I'm going to say one thing now, I'll probably end up repeating it. The only exception is that it's unwise to prescribe a tranquilizer to someone excuse me, who has a substance abuse problem or a history of substance abuse, including alcoholism, because these drugs, for people who've been clean and sober, they take one dose of tranquilizer and it can kind of reignite an addiction. So that's the one group. Longer term stressors, here oftentimes medications are not especially helpful and psychological approaches are better. Robert Frost says the best way out is through. And one way that people get through something is by drugging themselves. And that is with either over-the-counter stuff like alcohol, for instance, or illegal drugs, recreational drugs, or prescription tranquilizers. And I think Robert Frost had something different in mind, and that is having to face the truth of difficult life circumstances and move through that part of the life and do the best you can to cope with stress symptoms, but also do some problem solving and trying to alter the situation if that's at all possible. And solutions that are just based on drugs oftentimes are not very lasting. Let's take a brief look at drugs for anxiety. First are the tranquilizers. You may hear them referred to as a class of medications, benzodiazepines. And Valium was originally in this class, and then other drugs that are somewhat similar are used more commonly. These days, Xanax, excuse me, Ativan and Klonopin. They are really potent anti-anxiety medications. They start working within 45 minutes, typically after you swallow the pill. And depending on the dose, they can significantly reduce anxiety symptoms. There are problems, however, with tranquilizers. And it's important to talk about this very briefly. One is cognitive impairment. If people take a high enough dose, they can't focus and pay attention enough, and so this could interfere with things like appropriate alertness when you're driving an automobile or being able to stay focused at work or at school. Cognitive impairment especially is seen in people that are older, in people that are elderly. Just sometimes a little bit of tranquilizer can cause great problems. Sedation is another thing. Well, some people use that actually as a side effect that helps people go to sleep, but it can cause problems during the daytime. Some degree, it's not huge, but problems of balance and coordination, and then once again in elders that can be problematic because the skeletal system is a lot more fragile, and if you take a fall, much more likely to get like a hip fracture or something like that, which is bad news. I talked briefly about addiction. People that are prone to addiction, and that's about around 15% of the population, if they start using these medications, can become just as dependent on them as they are on drugs like alcohol. And finally, if a person is taking on a regular basis moderate or high level dosage of tranquilizer and then they stop abruptly, they can experience withdrawal symptoms that go all the way from being very unpleasant anxiety and restlessness to, on occasion, there's been some fatalities. Some people have had grand mal seizures and it's resulted in fatality. So if people are on tranquilizers for longer than a couple of weeks, it's always going to be very important when it comes time to reduce the dose or to discontinue, to do this under medical supervision so you can gradually discontinue and avoid some of these terrible problems. Okay. The next class of drugs actually is just one drug in this class, Buspar. This is sometimes called an atypical tranquilizer to set it apart from the other tranquilizers, and it doesn't work fast. If somebody has some sudden onset, extremely stressful event, has a lot of anxiety, This is not the drug to go to because it typically takes, as you can see by the slide, taking it on a daily basis for 3 to 4 to 5 or 6 weeks before it starts to really kick in. So it's not for acute anxiety, but for some people that are living with very significant sustained levels of anxiety, and these are people who are having to endure very, very stressful life circumstances, or people who have generalized anxiety disorder, then this may be a drug that's helpful. It's not habit forming, which is good. And typically when it starts to work after a month or somewhat longer, people will say, you know, I'm just not worrying about stuff as much. And in other words, they're not kind of going over and over the same old stuff. And it seems to really target worry in particular. And when you stop worrying quite so much, then a lot of the physical symptoms of anxiety also start to become reduced. The drugs that are probably the most effective in longer term use in treating anxiety problems actually are antidepressants that target serotonin. These are the so-called SSRIs. As a free download on the website, there is a list of psychiatric medications, and you can look this up. You can look on the computer or download a copy for your own use and take a look at these specific medications and their doses and that sort of thing. All these were originally FDA approved for treating depression, but in the course of things, what's been discovered is these particular antidepressants, not all antidepressants, but the SSRIs, are very effective in treating a range of anxiety disorders. So they not only treat depression, but also anxiety disorders. But for depression and for anxiety, it takes 3, 4, 5 weeks of taking it on a daily basis before these drugs start to work. One benefit is once they're on board and then are effective, they're generally well tolerated. They're not habit forming. For the most part, do not have sedation as a side effect, or not going to interfere with the ability to drive or concentrate at work and that sort of thing. So they are not for acute stress, but they are for really long-term stressful situations that are significant, or for anxiety disorders. The one antidepressant that actually will make anxiety worse is Wellbutrin, which happens to be a good antidepressant for depression, but it's more energizing and activating. So many people that have taken Wellbutrin who already are having a lot of anxiety will notice that they're having even more so. I think I already mentioned that. This is kind of interesting, chamomile. I know every time I stay in a hotel, they have a little packet of chamomile tea, and it's supposed to help you have, more happy dreams and sleep better, go to sleep faster, and stuff like that. And it never worked for me, but it may for some people. But that's not what I'm talking about. There's a study that's been done and it's been replicated where they're showing that real high dose chamomile, and when I say high dose, I'm talking about between 1,200 and 1,500 milligrams of chamomile taken daily after about 4 weeks. People have this constant generalized anxiety. It begins to lessen. So this is not, again, not something to treat sudden onset stress or anxiety, but for people who are living with a significant amount of generalized and continuous or chronic anxiety. And by the way, if you try to, a cup of chamomile tea probably has about 300 milligrams of chamomile. If you drank enough of that at bedtime, you'd have to get up and go to the bathroom all night long if you're trying to get 1,500 milligrams. So this is where you have to go to the health food store and get chamomile in pill form. The majority of anti-anxiety drugs are prescribed by primary care doctors rather than psychiatrists. And the biggest problem here is oftentimes there's an inadequate amount of time to really do a thorough, comprehensive evaluation and also to do tight follow-up. Really, every person who's on a psychiatric medication, in my opinion and the opinion of most psychologists, psychiatrists, needs to be in therapy as well. But we also realize lots of people are only taking medications, and so if you're being prescribed this medicine by a primary care doctor, please don't feel bashful at all about keeping in close touch with them until you know that the medication is really working for you. This, here's your prescription, I'll see you in a month, doesn't work. You need to have more frequent contact, and in our managed care environment right now, that means oftentimes it's the patient who has to call the doctor and initiate that kind of contact. Psychological treatment, generic talk therapy. Now, what do I mean by this? talk therapy means a lot of different things. But what we're looking at here are kinds of psychotherapies where people get together with therapists and they really try to get clarity about what's going on in their life, to identify problems that they might be able to solve, to understand more about their own areas of sensitivity, also discover more about themselves, the kind of things that matter to them in life, and based on increasing clarity about that, to start to take action in their life. And another thing too is when people have had major losses and they're dealing with very intense or prolonged grief, in talk therapy, the ability to talk again and again and again about these painful situations can facilitate mourning and some lessening of grief. So there's really a place for talk therapy, and many people that have a lot of generalized stress can benefit from this. But in addition, there are 3 versions of therapy that have been specifically designed to treat anxiety, stress, and anxiety disorders. Cognitive therapy, what it really does here is it focuses on critical thinking and maintaining perspective. And for instance, the person who's feeling very stressed may think or say, and at some gut level really believe, things are never going to get better. And of course, it's a real human thing to jump to a conclusion like that when the current situation is not good, okay? And you don't see an end in sight. However, people don't have the ability to predict the future. That may be an example of an inaccurate conclusion. A more accurate conclusion might be, I don't know how long this is going to last. It may last a while, but it's impossible for me to know for sure. I know that right now I'm having a difficult time, but I can't predict the future. And a lot of cognitive therapy really helps people to step back from the situation and try to get a realistic perspective about what they're facing. Exposure therapy, this is for things where people have developed particular fears, being afraid of flying on an airplane, for instance, or public speaking, where anxiety techniques, which we'll talk about here in just a few minutes actually, can be helpful, but they need to combine that with actually getting out there and starting to face their fears. And finally is problem-solving therapy. And this is finding a place especially popular in working with elders. It could be any age, of course, but this basically is trying to be either in an individual therapy or in group therapy, get more clarity, once again, about what's going on here and how can I fix it. And a lot of times that can make a big difference as well. So there are different kinds of psychotherapies. And if a person is seeking out therapy, first off, you want to find out very specifically if the therapist that you are considering seeing has expertise in treating particular kinds of anxiety disorders. It's everybody's right to make inquiries about that on the telephone when you first call a therapist. Building resilience. What doesn't kill you makes you stronger. Nietzsche said that. And Hemingway said this famous quote, "The world breaks everyone, and afterwards many are strong in the broken places." There's 2 sides of the coin here. Facing fears and trying your best to solve problems, take action, change situations, and manage stress is the way to go for many people. And many people discover after they move through a particularly stressful time in their life, you know what, I'm stronger than I thought I was. And it's very clear that for many people, the way through is to intentionally face these things that are difficulties head on. But the other side of the coin is not everybody's made of the same stuff. And there are certainly people who are exposed to highly stressful situations where they don't have the ability to adequately cope with that. It can be enormously emotionally damaging for them. Now, what I'd like to do as we're getting into the last part of this video is talk about some anxiety management techniques. If you see a therapist, they're likely to introduce a number of these. I want to mention just a few, some of which you may be familiar with, but some are actually kind of new in psychology as a way of rapidly reducing anxiety symptoms. When I would meet with a patient who had significant stress or anxiety symptoms, among other things, and looking at what was causing that and so forth, I would want to teach them to use these particular techniques to frequently turn the volume down on their stress symptoms. And so we're going to have about a half a dozen of these stress management techniques that I'm going to show you right now. And I would tell my clients, I'd say, now the odds are, out of the 6 different approaches, maybe 2 of them will really work well for you, and the others not so much. But we got to try each one because everybody's a little bit different. So let's run through this. Now the first thing, when people first hear about this, it strikes them as being silly and bizarre. And this is doing what they call the Kegel exercise. Kegel exercise, many women are familiar with this, something that they are instructed to do after delivering a baby. Let me show you this next slide here for just a moment. And what it involves tightening your sphincter. Now, if you went in to see a therapist and the therapist said, I'm going to teach you how to reduce anxiety by tightening your sphincter, it probably would be understandable if you just got up and ran out of the office thinking this person's a kook. But here's the deal. If you tighten that muscle and hold it for 20 to 30 seconds and then release, what this does is it activates the parasympathetic nervous system. You may remember from college or high school biology that the parasympathetic system is exactly the opposite of the sympathetic or fight or flight system. It relaxes and calms people down. And this is not anything magic or kooky. It physically activates a particular nerve pathway that turns on the parasympathetic system. Now the good thing about this is when this works, and typically you have to do this maybe 2 or 3 times and wait maybe 30 seconds in between each one. When this really works for people, it's something you can do that is very inconspicuous. So if people are in a public setting, then you can do it without calling attention to yourself, and that's one of the real benefits of using this as an anxiety management technique. The other is slow, deep breathing with a stretch. Now, it's clear what it's like on the slide here, but I'm going to do it myself, and it means bringing your shoulders and arms back and breathing in, but you're breathing in deep, and that is trying to get the air down deep in your lungs. The combination of stretching and what they sometimes call diaphragmatic breathing, deep breathing, also activates the parasympathetic nervous system. And for me personally, the Kegel response, the Kegel exercise, and this particular stretch are really effective at reducing anxiety for me. They may or may not be for you, but this is for everybody to try it to see which one works best for them. We already talked about that. Just skip that. Sorry about that. Breathing. Okay, I want to talk about 2 forms of breathing. One is when a person is feeling mild to moderately stressed out. Okay, I'm not talking about someone who is experiencing a huge wave of anxiety or a full-blown panic attack. We'll talk about that in a minute. The breathing technique for that is going to be different. Now, there are many versions of this, but the one I have up here is the one that's probably used the most and is very effective for many, many people. You know, a lot of people say, oh, if you're feeling nervous, take a nice couple of deep breaths. Well, that's really not exactly what is effective. Okay, now what we're doing here is we're taking in slowly a deep breath, again, into the lower part of your lungs, and this will allow, it'll make your stomach kind of stick out or pooch out a little bit. Sometimes people call it belly breathing or diaphragmatic breathing. But we're taking this in to a count of 4, like this. 1, 2, 3, 4. And then holding it for a count of 7. 1, 2, 3, and so forth. And then very slowly exhaling to a count of 8. I've done this myself, but I've also done it with a lot of my patients who are on the edge of feeling very anxious. And oftentimes doing this once, but more oftentimes, like maybe even doing it twice, noticeably more calmed down. All right, so that is one version. The other version, however, is quite different. And this is if a person is extremely anxious or having a panic attack, and they're starting to notice that they're getting lightheadedness or shortness of breath. This can lead to hyperventilation. And taking a deep breath here actually makes it worse. Let's take a look. You can induce a state of hyperventilation by doing one of 2 kinds of breathing, and this happens when people are really, really anxious. One of them is rapid, shallow breathing, like this. The other is sighing. Now what's happening in both of those forms of breathing is it's changing the balance of oxygen and carbon dioxide in the bloodstream. And you can see here on this slide, the oxygen levels very rapidly reach 100% saturation. In fact, most of them are close to that anyway. The main thing that happens, every time you continue to breathe, there's more and more carbon dioxide being removed from the bloodstream. And when it gets to a certain point, it causes a condition called respiratory alkalosis. And this is where it creates some of the most really frightening and disturbing symptoms of intense anxiety, especially shortness of breath. Let me show you a slide. These are brain images here. This person does not have a huge amount of stress or anxiety disorders, a normal, healthy adult volunteer. But if you look at the diagram on the left, we see there's a lot of areas of the brain for this person and for all of us, even when we're at rest, that are active. And then they were asked to hyperventilate, to breathe rapidly for 1.5 minutes, and look what happens. Among other things, a very significant change in brain metabolic activity, and this is because of constriction of arteries that occur with respiratory alkalosis. And so the person who is getting close to or into hyperventilation is going to have the sensation of, oh my God, I'm smothering, I can't get enough to breathe. And that's one of the most frightening experiences that a human can experience, like drowning. Or this is one reason that waterboarding is considered to be such a horrific torture. And so in addition to having the anxiety, now the person understandably is very afraid because the symptom itself feels like I'm going to die, like I'm going to smother. And so the tendency then is to breathe more. Now the problem is this, actually in your bloodstream, when you're hyperventilating, the oxygen levels are maxed out. There's plenty of oxygen there, but it's not getting delivered to the brain. And there's two reasons for that. One is that parts of the brain that are constantly monitoring oxygen supplies in the blood, the arteries that feed that are getting constricted, so they're actually getting less blood to that part of the brain stem. And that is interpreted as, oh, I'm not getting enough oxygen. And the other thing is that oxygen binds onto proteins in the blood and it doesn't get released as easily when a person's hyperventilating. So here, increasing breathing or deep breathing actually makes this a lot worse. And it's going to lead to lightheadedness, dizziness, shortness of breath, and oftentimes people start feeling really confused. In the video that we saw of the woman in the elevator is a good example of this. Her friend was talking to her and she was going, what? She couldn't understand that person because parts of the brain that are involved in interpreting language and speech are becoming metabolically offline or are not working. And it's understandable then that people, when they have these symptoms, is enormously frightening. This is where the tried and true technique of breathing back and forth into a paper bag really works. And every time a person exhales, the air coming out of their exhalation has higher levels of carbon dioxide, as we talked about, but then it's re-inhaled, and that very quickly is bringing back a balance of oxygen and carbon dioxide in the bloodstream. And this is why oftentimes within 20 seconds or 30 seconds, all these horrible symptoms really go away. And it feels almost like a miracle. The most important thing I want to say to you about this is when people are using this, and in fact it actually works really well for them, is that a mistake is made oftentimes, oh, I feel better now, and stop doing it. And then without thinking about it, they kind of go back into rapid shallow breathing or sighing. And so it's best to stick with it for a couple of minutes until it's like, I'm really okay, and then stop. So that's obviously quite a different technique than taking deep breaths. Okay, we already talked about acute stress reduction with exercise, radical acceptance. In the midst of very, very difficult life circumstances that feel overwhelming, there's different things that people can do to try to maintain some perspective. And one of these is called radical acceptance. And this is not saying, oh, well, life is hard and, that things happen. No, it's not that. Life happens, and sometimes it is a tragedy. This is not trying to pretend like things are okay when they're not okay, I can accept this. Well, maybe it's hard to accept, okay? What radical acceptance is, however, is at moments when somebody's experiencing very, very intense negative emotions. Certainly could be fear or anxiety. It could be also sadness or anger as well. But radical acceptance, you stop yourself and do a couple of things, okay? This comes actually from an ancient Buddhist tradition that struggling against suffering increases suffering. How do people do this? They say, it shouldn't be happening. I can't believe this. I don't deserve this. What is going on? This is not right. This is not fair. That's what we're talking about, struggling against this. Step one with radical acceptance is to say time out and basically stop doing this. It's not a matter of what should or shouldn't be, what's fair or isn't fair. And instead, then to just say to yourself, it's not a matter of what I deserve or whatever, but this is happening or has happened. It's just the truth. Oftentimes, with that alone, people will notice in the moment, they begin to settle down a little bit, okay? An additional two things that can be done that oftentimes make this even more helpful is to, as you can see on the slide here, then give yourself permission to have normal human emotions. And for instance, if somebody has gotten fired from a job or they've lost a loved one or something like that, they may say, you know what, it's normal to feel really upset about stuff that's so painful for a human being. And you know, to feel the emotions or to cry if that seems like that's, it feels like crying, okay? And finally, in this brief period of time, we're talking about like 2 or 3 seconds, is to say, in this moment, I'm doing the best that I can. And when I must tell you that in my career in psychology, which goes back more than 30 years, of all these kind of techniques and strategies, this is absolutely the top or close to the top of the list. It's quite amazing how when people learn how to practice this, again, you don't do it all the time, but times when it feels like you're on the edge of being overwhelmed, it is remarkably helpful for many individuals that are suffering. However, acceptance does not mean to collapse into powerlessness. Winston Churchill says, if you must walk through the valley of the shadow of death, just don't stop. So radical acceptance is about taking care of yourself and reducing stress symptoms in the moment, but it's certainly not about not taking action. Taking action to change situations obviously is a very important part of resolving stress in a person's life. I'm going to mention very briefly, we're getting close to the end, there are a number of alternative techniques that I have not talked about that have merit. And they might include massage, yoga, tai chi, prayer, meditation, spirituality, and so forth. I don't mean to ignore these and some other alternative techniques because for many people they can be very, very beneficial, but time does not allow to cover all of them. I just wanted to mention, however, that these are oftentimes helpful for many individual people. Okay, taking action. Give self-help techniques a try. Okay, some of the things we talked about. People can do this on their own. Reduce or eliminate caffeine, get better quality sleep, more sleep, better quality sleep, exercise, get a physical exam. It never hurts to do that, to rule out the possibility that there might be some kind of underlying medical condition, and don't be hesitant to go in and see a therapist or a counselor. On the website, we have available for free as a download a book. I'm one of the co-authors of this book. It's called Make Every Session Count. You can access that and read it on your computer or download a copy. And this is a book that has been written to really talk about what psychotherapy is, the different forms of therapy, how to make the absolute most out of psychotherapy, how to choose a therapist, and also how to negotiate and work within your insurance coverage, managed healthcare, or HMO to get appropriate psychological or psychiatric services. So that's available completely for free. And finally, I'll say it once again, managing stress is one thing, and highly resilient people figure out how to do that. But ultimately, there are many situations that the antidote for feeling overwhelmed and powerless is just taking action and negotiating for changes in relationships, finding a job that's a better fit, or not continuously doing something that in your heart of hearts you really don't like. Taking action, an antidote for powerlessness. Okay? So thank you very much for watching. Bye-bye.